link between fluoride and cancer, according to some experts, including Dr. John Yianniamis, who has written a book called Fluoride, the Aging Factor. Aspartame, NutraSweet, is associated with tumors, particularly brain tumors, cancerous tumors. We do know that with meat and poultry and fish, not only do the animals have disease, which we can potentially get from them when we eat the meat, but anytime you cook it, not only broiling, but anytime you cook these meats, they produce carcinogens, any kind of cooking, whether it's meat, poultry, or fish. Dairy herds are infected with bovine leukemia virus and the bovine AIDS virus. Milk is infected with the bovine leukemia virus. And in fact, a 1980 study showed that there was an increase in human leukemia in areas with high levels of bovine leukemia in the dairy herds. Sugar immobilizes the immune system for 4 hours after you eat it. Your white cells cannot resist disease. Caffeine and alcohol are both dehydrating agents, and they look like they have a relationship to breast cancer. Preservatives are in all packaged foods, in cans and boxes, and some of these actually cause cancer. And so do the food dyes, which are known to be carcinogenic. This new fake fat, the Olestra, will take the fat-soluble vitamins out of your body. You need those vitamins in order to have a healthy body and prevent cancer. Processed food, white rice, white bread, all the chemicals and the lack of nutrients that's in processed foods, all of these things contribute to a sick body. Also, something else that has shown a lot of evidence of suppressing the immune system are silicone gel implants in the breast. I would strongly suggest that if you have silicone gel implants in your breast, to have them removed. There are all sorts of cases of women who have had severe autoimmune diseases because it looks like because that they have had these silicone gel implants in their body. And in fact, there are lawsuits going on about that at the present time. Smoking produces TARS. You know that there is an association between smoking and lung cancer. There's also an association between smoking and uterine cancer and cancer of the mouth, esophagus, bladder, kidney, and pancreas. Lack of sunlight. Sunlight actually decreases the size of internal cancerous tumors. Lack of fresh air and exercise. Cancer thrives in a low oxygen environment. And then, of course, all of these cancer chemotherapeutic agents cause cancer too. And then, if those don't work, they want to do a bone marrow transplant on you. In order to do a bone marrow transplant, they have to destroy all of your immune system. Well, what can that possibly do? It's your immune system that you need to get you well. Not only that, if you have a transplant of an organ, such as a kidney or a liver, they give you these same chemotherapeutic agents to wipe out your immune system so you will not reject the transplant. As you can see, what you really need to do to get well and to prevent cancer is to feed your body well, hydrate your body well by drinking a lot of water, because it has been shown clearly that dehydration is one of the major factors in causing cancer. And in fact, I could not get well until I started drinking large amounts of water. I'm talking about the average person needs a minimum of 10 glasses a day just to replace their water losses for every day. I had not been a water drinker all of my life. In fact, I was drinking coffee and caffeinated soda. So I found out I was about 18 years behind in my water drinking. These are the simple things you can do: sunlight, fresh air, exercise, water, good food. These will not only prevent cancer, but this is exactly the way that I got well from cancer. Now, I have 2 videos out. I will tell you at the end of this video how you can get well from cancer and many other diseases. But this video, called "You Can't Improve on God," is the exact step-by-step plan that I use to get well from cancer. And this video, "Cancer Doesn't Scare Me Anymore," shows you what you shouldn't do if you have cancer. It shows the destructive effects of chemotherapy and radiation and documents it from the medical literature. It tells you why cancer is big business and why doctors are not really being taught how to get patients well. The next category is autoimmune diseases. At least that's the way we categorize them in medicine. Rheumatoid arthritis, lupus or systemic lupus erythematosus, scleroderma, polymyositis, dermatomyositis, and then polymyalgia rheumatica. All of these are really related to joint and tissue problems. And so the doctor may tell you that your immune system is too strong. But it's impossible for the immune system to be too strong. That's like being too healthy. When you're too healthy, you're just as healthy as you can be. When your immune system is working properly, it's not going to make you sick. If you have one of these diseases, it means that your immune system is not working properly and it's suppressed because of some of these things we've been talking about. Now let's take another look at what these doctors treat these diseases with, these drugs that are so harmful. The drug of choice for these diseases is actually cortisone or prednisone. Most doctors treat every one of these diseases with prednisone. What are the side effects of this disease? Well, right out of the physician's desk reference, it will tell you. Cortisone causes peptic ulcers, osteoporosis, softening of the bones with spontaneous fractures, mental disturbances, psychoses, degeneration of the nerves, acne, hirsutism, which is excessive growth on the face of hair, particularly in women, diabetes, hypertension, disturbances in the metabolism and utilization of proteins and fats, reactivation of tuberculosis. It causes retention of salt and water in the tissues. It also can cause you to work when you don't have energy and a tremendous appetite, so you will gain weight. When my mother was on cortisone years ago for a problem she had, her face got about as big as the moon. Also, cortisone suppresses the immune system and can lead to cancer. This is not the way to treat these diseases. For rheumatoid arthritis, doctors will often put a patient on high doses of aspirin. But aspirin can cause gastric ulcers, ulcers of the stomach, ringing in the ears, and anti-inflammatory drugs that you can get either from the drugstore or by prescription from your doctor cause gastrointestinal bleeding, peptic ulcers with perforation, liver damage, kidney failure, and high blood pressure. Methotrexate is now considered the treatment of choice by some doctors for rheumatoid arthritis. Well, methotrexate, we just saw in the cancer portion, is a chemotherapy agent that can cause death. It can also cause cancer. It causes ulcerations in the entire gastrointestinal tract. Now you see, these diseases are actually from nutritional deficiencies. Not getting enough of the food you need, eating too much of the food you don't need, having improper elimination, not drinking enough water. In fact, I know many patients who have gotten well from rheumatoid arthritis. In fact, many of them who have been in wheelchairs who've been able to get up from their wheelchairs and get well. Now, if you have severe permanent destruction of joints, I'm not telling you that you're going to be out dancing, but I can tell you that you can stop the progression of the disease and reverse the changes that are not permanent. My mother, as I told you before, at the age of 85, had this severe autoimmune disease called polymyalgia rheumatica, and she got well